해도 될지 생각해 너와의 추억을 산 butterflies 어디로 갈래 국내 아닌 멀리 묻는 둘이면 상관없 비행기 예매 우리 해도 될지 생각해 너와의 추억을 산 butterflies
Explain to the patient why we perform this and how will this help the differential. Okay, you got the consent first and then prepare material. Help the patient to remove his or her clothes. Okay, help the patient to remove his clothes to uncover this area and make sure, usually, because this is the model, you know this is the right place for that, but in the real person you'd better make sure this is the right place for the puncture and check twice before you do that. Okay, and this is the anterior superior iliac spine, which is right here, and okay, you can disinfect this area first, and with your local with your iodine disinfect agent. Okay. And disinfect this area in a concentric way. Make sure this is the right place and disinfect this area 3 times. The first one should be the largest one, the largest diameter, the circle should be the biggest, and the second should be a little bit smaller than the first one. Try to leave no skin behind and disinfect this area 3 times. Number 2, this is number 3. Do that again. And disinfect this area. Okay. Put it here. Usually in our body we put it in the yellow one because it may contaminate by those patients. Sweat, water, blood, and other issues. So make sure again this is the it doesn't expire. So this is the right kit for that, and it didn't expire. And open the kit. Okay, I will give an example here. Open the kit. You just have 2 layers, and place here. And this is the second layer for the kit. Okay. Put it on the table. Okay. Open the tray without contaminating inside of the kit. Okay. I guess you guys have already practiced that in your other particular kit. So you should open it. They will teach you guys to grab here. So you won't contaminate the inside of the surface. The outside layer of the glove, okay? Grab it here, wear the glove, okay? Wear the glove like that. Okay? So you should check your instrument twice or maybe other issues before you perform this well. And you do have a needle, a bone marrow aspiration needle in the tray. Okay. That's fine. Okay, this is the needle. Usually it's okay because it's a disposable needle, so it should be okay, but in some developing country they disinfected the needle and repeat to use that, so you have to make sure this is the perfect needle for that to help you guys for the following process. Okay? Usually you have a 20 milliliter syringe and a 5 milliliter syringe, and you have the needle for that. Some gauze and a drape with a hole in it. So you open the drape without contaminating anything. Place the hole in the center of the puncture site. Okay? And connect the syringe. Usually, come on, let's do this is the needle for that. Usually the 5 milliliter syringe needle is black, so we connect to this syringe. And usually you will ask your assistant to double check the lidocaine with you. So usually they have an assistant for you to open the lidocaine for you, and you draw. I'll make an example. So you will draw maybe several milliliter lidocaine inside the syringe. Okay. So usually you have to double check the name with your assistant. So you will repeat, this is a 1% lidocaine. So your assistant will repeat that. Oh, this is a 1 or 2% lidocaine. You check the name with your assistant. Okay. So for example, this is filled with those kind of lidocaine already. So because we are just practicing it. So open the needle, and this is the needle, and stabilize the skin, stabilize the patient's skin, and perform what they call intracutaneous injection. So which means that you have to penetrate the patient's skin with an angle like maybe 10 to 20 degrees. And once the slope enters the skin, and inject lidocaine, okay, and then penetrate the soft tissues beneath that, and finally reach the bone surface and perform the periosteum local analgesic. Okay, maybe inject it a little bit here, inject it a little bit here, inject a little bit here and here from several angles. Okay, and then, as I mentioned earlier, usually you grab the gauze, because in the real person he may bleed a little bit when you make the puncture. So you grab the gauze with your left hand and your needle with your right hand. Usually you have to grab it very stable, because it's very hard to penetrate the patient's bone. So first of all, penetrate the patient's skin, and usually perpendicular to the surface of the anterior superior iliac spine, and penetrate it. It should be very hard to penetrate the patient's bone. And finally, once you feel those kind of resistance diminish, and this is the right place for that, and the needle should be stuck into the bone, so it should be very stable. So remove your stylet and connect the syringe to collect the samples of the bone marrow. Okay. Some models have some red inside it, so you can draw a little bit out. But in this model, I know that it doesn't have those kind of things. So in the tray, for some commercial tray, it has some sterilized glove. So in some country, you have to perform this all by yourself. But in China, we do have some assistant for that. So we don't have those kind of the slide in the tray. So if you have those kind of slide in your tray, sometimes you have to prepare it before you perform the bone marrow aspiration. This is the slide. Okay, usually you place the slide over here, and then, as I mentioned earlier, you may collect a little bit bone marrow samples and put it here, and dip a little bit like this one, and make a slide. Okay. What is more important for you guys to make a slide is to do not stuck in somewhere, and make sure the whole process is smooth, and the angle is not that kind of big, so because it will be hard for you guys to slide over another slide. Okay? The angle should be a little bit smaller, maybe 10 to 20 degrees, and slide over another glass, and you'll make a perfect smear. Okay? Usually you have to prepare maybe 5 to 7 smear to make the diagnosis. So dip a little bit again, and slide it over another glass and make a smear. Okay. If you have already collected enough sample for that, usually it will tell you to place the stylet back and pull back the needle, and then use the gauze to uncover the area. okay? Because in the real person, he may have some kind of bleeding, okay? So, and finally, use the tape to stabilize the bolus, and the whole process is over, okay? The first thing is to, just like every other clinical procedure, don't contaminate inside of the tray. Number two, you should know the whole process before you do this. Number three, I guess you guys need more practice than just watching it over. It's okay, that's pretty much about it. So I will leave you guys some time to practice with your model, okay? Okay.
Bone marrow exams are generally safe procedures. Complications are rare but can include excessive bleeding, particularly in people with low numbers of certain type of blood cells like platelets, infections, generally of the skin at the site of the exam, especially in people with weakened immune system, long-lasting discomfort at the bone marrow exam site, and finally, rarely penetration of the breastbone during sternal aspirations, which can cause heart or lung problems. Bone marrow exams are often performed on an outpatient basis. Special preparation usually is not needed. If you will be receiving a sedative during the bone marrow exam, your doctor may ask you to stop eating and drinking for a period of time before the procedure. You will also need to make some arrangements for someone to drive you home afterward. In addition, you may want to tell your doctor about medications and supplements you take, because certain medications and supplements may increase your risk of bleeding after a bone marrow aspiration and biopsy. You can also tell your doctor if you are nervous about your procedure. Discuss your worries about the exam with your doctor. In some cases, your doctor may give you a sedative medication before your exam, in addition to a numbing agent, local anesthesia, in the site where the needle is inserted. Now, bone marrow biopsy. The doctor or nurse uses a long needle to withdraw a sample of solid bone marrow tissue. The biopsy needle is specially designed to collect a core of bone marrow. After the procedure, pressure will be applied to the area where the needle was inserted to stop the bleeding. Then, a bandage will be placed on the site. If you had local anesthesia, you will be asked to lie on your back for 10 to 15 minutes and apply pressure to the biopsy site. You can then leave and go about your day, returning to normal activity as soon as you feel up to it. If you had intravenous sedation, you will be taken to a recovery area. Plan to have someone drive you home and take it easy for 24 hours. You may feel some tenderness for a week or more after your bone marrow exams. Ask your doctor about taking a pain reliever such as acetaminophen. Site care. Wear the bandage and keep it dry for 24 hours. Don't shower, bath, swim or use a hot tub. After 24 hours, you can get the area wet. Contact your doctor if you have bleeding that soaks through the bandage or does not stop with direct pressure, a persistent fever, worsening pain or discomfort, swelling at the procedure site, increasing redness or drainage at the procedure site. To help minimize bleeding and discomfort, avoid rigorous activity or exercise for a day or two.